Hi, I'm Waseem Sharieff. I'm the program director for fellowship program at BC Cancer Abbotsford in Canada. So any resident wanna explore fellowship, talk to me outside. It's my pleasure to invite Saeed Elhaffari. He's a medical physicist, and he's going to talk about surface-guided radiation treatment.
Thank you, Doctor. It's a pleasure to be here. Thank you for the invitation. My name is Saeed Elhaffari. I'm a medical physicist, clinical application specialist with Vision RT. Just quick information about Vision RT. Vision RT is the inventor of the SGRT for now more than 25 years, and we are the leaders of SGRT worldwide with more than 300 systems working now around the world. So today we are not just talking about the SGRT for the treatment, but we have a different type of systems that under the umbrella of SGRT for the whole workflow of the radiotherapy. So we are talking about SGRT for simulation with SIM-RT that will help you to do 4D CTs and also to coach your patient for breath hold. We have now SGRT for planning, which called MAP-RT. It will give you the whole surface of your patient, and it will help you to do more non-coplanar treatment. We have also the most known and famous system for SGRT, which is Align-RT, that it can be used for inboard machines, but also for the C-arms Linux. And finally, we have this new technology that is this camera that is based on Sharieff radiation. So let's start with the camera that is used for these applications, which is the Horizon camera, the newest camera from Vision RT. This camera has a full field of view that will allow you to take the whole surface of the patient and which help you in different application. So let's start step by step. Let's start with the first step in radiotherapy, which is the simulation. And we start with SIM-RT. SIM-RT is a camera that will be installed in the CT room, and it will help you to do your simulation for the 4D CT and for the coaching of your patient and do the breath hold CT. So it's installed in the foot of the couch of the CT. It's completely invasive. Is nothing in touch with the patient. You don't put anything in contact of the patient. It's easy to install the patient on the CT room, and also it's gonna track your patient and the breathing of the patient virtually. It has also a small monitor that will help the patient to take their breath hold and monitor the patient. So it's also give you the access to the RTTs to be inside of the CT room, and then you can virtually monitor the breathing of the patient. So SIM-RT will help you do for the CT, non-invasive, nothing in contact of the patient, but also coaching the patient, your patient for breath hold. So let's go to the next step, which is the planning with MAP-RT. The same camera goes also into the CT room, but in this case of the MAP-RT, you will have two cameras on the side of the couch, and those cameras with this field of view that goes like 2 meters. You can have the surface of your patient from head to toes, plus the immobilization devices that you gonna use for your patient. So it will give you the surface of the patient virtually, and we can simulate this surface to your machine. So if in case you have multiple machines, of course, we can also choose your specific machine where you're gonna do the treatment for this patient, but also we can also choose a different plan if there is any sort of collision in those plans. So at the final, it will give you a map of collision. So you have your plan, but also you can have your collision map that will give you an idea about the angles that the couch or the gantry has an issue of collision with the patient or between the couch and the gantry. The next step is, after the planning, we go to the treatment. This is the most known system from VisionRT, which is AlignRT. As I said, it goes, we have two systems. One for the in-bore, it's called the in-bore, AlignRT in-bore. We can have it with ethos, with Halcyon, but also the latest one is with RadExact for tomotherapy. So it's a camera that will, it's a stereoscopic camera that use also a stereoscopic projector to project light, speckled pattern light to the surface of the patient. And then we can have the surface of the patient. And this surface, we can use it for the setup, of course, for with a setup with no tattoos, no markers. And also we can monitor the patient in 6DoF. And if the patient moves out of tolerance or breathe out of tolerance, we can stop the beam automatically. So also this AlignRT for in-bore is VisionRT is the only one that propose this kind of solution. So we have the camera on the ceiling for the setup phase, but for the treatment phase, we have an in-bore module that goes inside of the bore of your Halcyon or your ethos or your RadExact. And why we use this kind of camera, this in-bore camera? Because we can't see much of the patient when they are inside the bore with the ceiling camera. So as in this example, you will see that especially for head and neck patients and for breast patients, you will not monitor as if you have the in-bore system. One of the things AlignRT will allow you is doing a tattoo-less and free marks treatment. And with this option called postural video, you can set up your patient in no time. So it will give you a 29% less time than the average SGRT to set up your patient without any tattoos, without any lasers, without any marks. Also, some tools that will help you also in the setup. It's a new thing that we are offering starting from this year, which is called Beam Guide. Beam Guide will help you also during the setup to see where is my planned field R and where is my beam intended to be. So in this case, you can verify the position of your patient, but also you can verify the position of your patient with the beam that we are planning and we want to give to the patient. So we have this beam guide. It's a white outline that's the planned beam, and we have the orange. That's the predicted beam projection. We can see this even before we start the treatment. Another new feature this year, it's the auto ROI. So I know there is some users here of AlignRT between us, and they know that sometimes it takes a little bit of time to do the ROIs manually, and each time it will be different from a user to another. So with this feature, we can have auto ROI. So it will be automatically drawn on your align archie, and it will be standardized. So the same auto ROI will be the same for all your patients. Align archie is known mostly to use for the IBH because we have a lot of breast cases, but also not all of them can do a breath hold. So that's why we need some sort of free breathing treatment. That's why we have the respiratory model, which allow you to do treatment in free breathing based on the phase or amplitude gauging. Once you finish the treatment, you want to have reports. Align archie allow a generation of auto-generate the reports after each treatment, but now we can also integrate those treatments in your ARIA or Mosaic. So you can access directly on Mosaic or ARIA the reports from the SGRT treatment, and it will allow, for example, for the doctor, the consultant, to verify the treatment directly with the IGRT. And it will be also useful and beneficial for the billing purposes. The last one and the most interesting technology we have now is those RT. It is a new camera that goes with the horizon camera, and with those RT, we can see the radiation going through the patient. So before we did the simulation, we did the planification, but we never had the chance to see how the radiations go through the patient. So with this camera, this is the opportunity to see how this type of treatment goes. So this camera is based on Sharieff imaging or Sharieff radiation. Sharieff radiation is a faint blue light that go from the Sharieff radiation, and we cannot see it in the radiation oncology, in radiation therapy. We can see it in the higher energy facilities like nuclear facilities, but in radiation, because of the energy is less than those facilities, we cannot see it. But with this new camera, we can see the radiation, of course, in the entrance of the field, but also at the exit of the field for your patient. So those, we're gonna give some examples how we can see the Sharieff radiation. So an example here for a head and neck with a mask. So VMAT treatment, we can see the radiation where is intended. Of course, the second one will show you the cumulative dose. For example, if after multiple fields or after multiple days of the treatment, we can use this dose RT for a different type of treatment. It's not just for VMAT or 3D, but we can also see here on this example on the right for a treatment of SRS. Even with the small fields, we can see the Sharieff radiation. Another feature is you can see where we need this radiation from the planning. We can have this information from the planning, and we can see it on our monitor. And after that, the third one is we can see the cumulative dose from different beams, but also from different days of the treatment. So those RT will allow us to have more quality to our treatment. Of course, we have now the possibility to do the setup correctly with the SGRT, the IGRT, but now we can see where we're gonna treat our patient, and if there is some sort of error, we can intervene right away during the treatment. Thank you so much for your attention, and thank you for invitation for the AMSTRO.
Thank you for being so brief. Any questions? So, Saeed, we use surface-guided treatment for stereotactic treatments. Can this be, you showed about the DIBH, can this be used for partial breast to localize the seroma?
So SGRT is intended to be used for every type of treatment. We are not talking about the IBH for breast. We are talking about every SBRT, SRS, non-coplanar treatment. All you can imagine we can do with SGRT. For example, we have multiple cases, for example, for extremities. You can see, I know that extremities are very hard to set up. You need to a lot of time to set up, multiple times to do IGRT. But with these features and with SGRT, you can set up the extremities very quickly and with the minimum IGRT. We have also the SRS module. I didn't present it, lack of time, but we have a system that is have a possibility to do calibration of the system to the isocenter of your treatment field. So we can talk about SBRT also. Everything that you have in your mind, you can do SGRT and treat with it.
Thank you.
Welcome.
So since there are no questions, I would like to invite my